Many consultant diabetologists in the United Kingdom feel under pressure. There is a pandemic of type 2 diabetes worldwide and in the United Kingdom. There's an increasing variety of crucial interventions for people with both types of diabetes, and interventions are becoming increasingly complex. Diabetologists are trained to feel responsible for all the people with diabetes in their locality and aspire to provide the best, most up-to-date care. Yet their aspirations are readily hampered by forces outside of their control, inappropriate decisions sometimes being made without specialist involvement. It is often not appreciated that diabetologists usually also run the local endocrine service and the lipid service, and most are general physicians supervising the acute take in medicine. Whilst the combined pressures of reorganisation of postgraduate education, Junior Doctors' Hours initiatives and European Working Time Directive mean that junior doctor support is gradually whittled away, the number of emergency medical admissions rises relentlessly year on year. Against this background, it is entirely understandable that an organisation should form to bring together consultant diabetologists from all over the United Kingdom. The Association of British Clinical Diabetologists was founded at a meeting called by John Wales, Richard Greenwood and Ken Shaw at the Royal College of Physicians on June 13, 1997.
With the changes in diabetes care in the UK, there was a general view emerging that the needs of specialists and consultants in particular were not being met by alternative organisations. Since we established ABCD, it's grown steadily and it's now well established. We have about over half UK diabetologists now active members of ABCD, and it does seem to be providing them with the support and continuing education, continuing specialist education that they actually need. We meet twice a year, and there's general agreement, I think, that the meetings are of a uniformly high standard. A notable feature of the meetings is that there's a great deal of interactive discussion between the speakers and the audience. There's a very high level of audience participation, which you tend not to get in bigger meetings. We cover a whole range of subjects, not just recent advances in the management and therapy of diabetes, but also changing methods of practice. We include review lectures on endocrine subjects of interest to the members, and we do cover other issues. For example, in our most recent meeting we're having a discussion about Clinical Excellence Awards, which is of great interest to all consultants. We have a number of other activities which most of our members find extremely useful. We publish a newsletter 3 or 4 times a year which gives information about ABCD activities, our contribution to national initiatives such as the NSF, and other useful information for members. We also have a website, and this provides up-to-date information on any submissions that we make, for example, towards the preparation of NICE guidelines. In addition to these activities, we're investing quite heavily in supporting SPRs in our speciality, because there's a real need to help and encourage people who are training to be consultants. We are running once or twice yearly SPR meetings, which not only give them relevant CME, but also we hope will prepare them to fulfill the role of a consultant diabetologist.
And as the years have gone by, I realise that this group has actually become increasingly important as the pressures for consultant specialists in secondary care has received additional pressures from all sorts of directions. The National Service Framework, the pressures of acute medicine, the move towards a primary care-led NHS has actually made our jobs much more difficult, and it's become very clear indeed that there is no other organisation to represent the needs of consultant physicians specialising in diabetes and endocrinology in the UK, not just for the benefit of us, but for the benefits of the patients whose care we provide both in primary and secondary care settings.
What is encouraging now is some 6 or 7 years after the setting up of the ABCD Association, is how much it is now been accepted as a very necessary and important forum for consultants with this specialist interest to get together to talk about the big issues of the day. And there really is no other platform or forum where such consultants can get together and talk about problems which they're meeting in their localities within their own services.